Hi everyone, I'm Dr. Ng from Taiwan. The title of our study was a 3-year longitudinal survey of overactive bladder in community dwelling male resident aged 40 years and above. I have no obligation to disclose. The aim of the study is to evaluate the prevalence, incidence, remission, and persistence of overactive bladder in male community resident aged 40 years and above in central Taiwan. This is a 3-year longitudinal cohort study carried out at the communities in the west and south area of central Taiwan. Community residents aged 40 years and above were invited to participate in this study. And in our study, we emphasize on the data of the male residents. The participant is asked to fill in a structured questionnaire containing the Chinese version of overactive bladder symptom score questionnaire at baseline, and the same questionnaire was sent to this resident for 2 more consecutive years. Overactive bladder was defined as a total OAB-SS score more than or equal to 4 and urgency score more than or equal to 2. The incidence, persistence, remission, and relapse of OAB were calculated at the end of 3rd year. The risk factor associated with OAB were evaluated using the multivariate logistic regression analysis. Totally, 942 male residents filled in the questionnaire at baseline. The prevalence of OAB was 15%. The prevalence increased with age when stratified into different age cohort, and which is statistically significant. 84.9% of male residents complete all the questionnaire for the 3 consecutive years, and the data were analyzed for the change of OAB status and was shown in the figure 1. For the risk factor of OAB, our study showed that OH was the only risk factor for these male residents. Figure 1 shows the OAB status for male community residents. As you can see, the 2nd year incidence rate was 10%. The 3rd year incidence rate was 6.2%. The 2nd year remission rate was 47.4%, and the 3rd year remission rate was 46%. The 2-year OAB persistence rate was 30.3%, and the relapse of OAB in the 3rd year was 23.1%. Our study showed that the prevalence and yearly incidence of OAB are high in male community residents aged 40 years and above in the central area of Taiwan. Although the medical history of OAB or the surgical intervention for these residents were not evaluated in this study, and yet the OAB persistence rate was 30.3%. Age is an important risk factor for OAB. Thank you for your attention.